Sodium bicarbonate, NaHCO. Expanded lecture note. Welcome to our channel. Today, we're diving into the world of sodium bicarbonate, a versatile and essential medication used in various medical settings. From emergency rooms to operating theaters, sodium bicarbonate plays a critical role in saving lives and managing complex conditions. Join us as we explore its uses, benefits, and best practices. Other names for sodium bicarbonate. 1. Baking soda. This is a common household name for sodium bicarbonate, often used in cooking and baking. 2. Bicarbonate of soda. This is another name for sodium bicarbonate, often used in British English. 3. Sodium hydrogen carbonate. This is the chemical name for sodium bicarbonate, reflecting its composition of sodium, hydrogen, and carbonate ions. These different names refer to the same substance, which has various uses in medicine, food, and industry. Introduction to sodium bicarbonate. Sodium bicarbonate is a systemic alkalinizer and buffering agent widely used in medicine for treating metabolic acidosis, drug overdoses, hyperkalemia, and cardiac resuscitation. It acts by neutralizing excess hydrogen ions and raising blood pH. 1. Sodium bicarbonate is a systemic alkalinizer and buffering agent. It helps regulate the body's acid-base balance by neutralizing excess acids. 2. Widely used in medicine for treating metabolic acidosis, a condition where blood becomes too acidic due to an imbalance in the body's acid-base balance. 3. Drug overdoses. Sodium bicarbonate can help counteract the effects of certain drug overdoses, such as those involving tricyclic antidepressants or aspirin. 4. Hyperkalemia. High potassium levels in the blood, which can be life-threatening if left untreated. 5. Cardiac resuscitation. Sodium bicarbonate may be used during cardiac arrest to help restore a stable heart rhythm. 6. Acts by neutralizing excess hydrogen ions raising blood pH. By binding to excess hydrogen ions, sodium bicarbonate helps increase the blood's pH level, making it less acidic and restoring a more normal acid-base balance. Classical definition of sodium bicarbonate. 1. A weak alkaline salt. Sodium bicarbonate has a pH level that is slightly alkaline, which helps counteract acidity. 2. Used to correct acid-base imbalances. It helps restore the body's normal acid-base balance by neutralizing excess acids. 3. Reduce gastric acidity. Sodium bicarbonate can help alleviate symptoms of heartburn, indigestion, and other conditions caused by excessive stomach acid. History of sodium bicarbonate. 1. Discovered in the 18th century as a natural component of mineral waters, sodium bicarbonate was first identified in natural mineral water sources, highlighting its natural occurrence. 2. First used in medicine in the 19th century. Dyspepsia and acid reflux. Its ability to neutralize stomach acid made it a treatment for digestive issues, providing relief from symptoms like heartburn. 3. Adopted in emergency and critical care for metabolic acidosis and resuscitation. Over time, sodium bicarbonate role expanded to include treating severe acid-base imbalances and supporting cardiac resuscitation efforts in critical care settings. Classification of sodium bicarbonate. 1. Class. Antacid. Sodium bicarbonate helps neutralize stomach acid, providing relief from heartburn and indigestion. 2. Alkalinizing agent. It increases the pH level of bodily fluids, making them acidic and helping to restore a normal acid-base balance. 3. Electrolyte supplement. Sodium bicarbonate can help replenish bicarbonate ions in the body, which is essential for maintaining proper electrolyte balance. 4. Pharmacological group. Systemic buff. As a systemic buffer, sodium bicarbonate helps regulate the body's acid-base balance by neutralizing excess hydrogen ions and maintaining a stable pH level. Chemical properties of sodium bicarbonate. 1. Formula. NaHCO. This is the chemical formula for sodium bicarbonate, indicating it consists of sodium, hydrogen, carbon, and oxygen atoms. 2. White crystalline powder. Sodium bicarbonate appears as a white solid in its pure form, often in a powder or crystalline structure. 3. Soluble in water. Sodium bicarbonate dissolves easily in water, which is important for its use in medical and other applications. 4. Releases CO and HO when reacts with acid. When sodium bicarbonate comes into contact with an acid, it reacts to form carbon dioxide, CO, and water, HO, which helps neutralize the acid. This reaction is key to its role as an antacid and buffering agent. Physical properties of sodium bicarbonate. 1. Appearance. Fine white powder. Sodium bicarbonate typically appears as a fine, white powder, which is its most common form. 2. Tasteless to slightly alkaline taste. When tasted, sodium bicarbonate can range from being tasteless to having a slightly alkaline or bitter taste. 3. Solubility. Freely soluble in water. Sodium bicarbonate dissolves easily in water, which is important for its medical and industrial applications. 4. Insoluble in alcohol. Unlike water, alcohol does not readily dissolve sodium bicarbonate, which can be relevant in certain formulations or uses. 5. Stable in dry form. Sodium bicarbonate remains stable when kept dry, maintaining its properties and effectiveness. 6. Decomposes with heat leading to NaCO plus CO plus HO. When exposed to high temperatures, sodium bicarbonate breaks down into sodium carbonate, NaCO, carbon dioxide, CO, and water, HO. This decomposition reaction is important to consider in storage and handling. Mechanism of action of sodium bicarbonate. 1. Buffers H ions. HCO plus H leading to HCO, right pointing arrow, HO plus CO. Sodium bicarbonate neutralizes excess hydrogen ions, H, in the body, helping to maintain a stable acid-base balance. Reaction converts hydrogen ions into water and carbon dioxide, which can be easily eliminated. 2. Raises plasma bicarbonate concentration leading to increases blood pH. By increasing the concentration of bicarbonate ions in the blood, sodium bicarbonate helps raise the blood pH level, making it less acidic and correcting acidosis. 3. Reduces gastric acidity when given orally. When taken orally, sodium bicarbonate neutralizes excess stomach acid, providing relief from heartburn, indigestion, and other symptoms of acid reflux. 4. In hyperkalemia leading to shifts K into cells by alkalinizing serum, sodium bicarbonate helps manage high potassium levels, hyperkalemia, by increasing the blood's pH level, which encourages potassium ions to move into cells, temporarily reducing serum potassium levels. Pharmacokinetics of sodium bicarbonate. 1. Absorption. Rapid oral absorption. Sodium bicarbonate is quickly absorbed into the bloodstream after oral administration, allowing it to start working rapidly. 2. Distribution. Extracellular fluid. As absorbed, sodium bicarbonate distributes throughout the extracellular fluid, including blood and interstitial fluid, where it can exert its buffering effects. 3. Metabolism. Not metabolized, acts as buffer. Sodium bicarbonate is not metabolized by the body, instead, it acts directly as a buffer to neutralize excess hydrogen ions and maintain acid-base balance. 4. Excretion. Renal. As bicarbonate or CO after buffering, sodium bicarbonate is eliminated from the body through the kidneys, either as bicarbonate ions or as carbon dioxide after reacting with hydrogen ions. This process helps regulate the body's acid-base balance. Pharmacodynamics of sodium bicarbonate. 1. Onset. Immediate IV 15–30 minutes. Oral sodium bicarbonate starts working immediately when administered intravenously IV, while oral administration takes slightly longer, typically 15 to 30 minutes, to produce its effects. 2. Duration. 1 to 2 hours. The effects of sodium bicarbonate typically last for 1 to 2 hours, depending on the dose, route of administration, and individual patient factors. 3. Effect. Raises serum pH. Sodium bicarbonate increases the pH level of the blood, making it less acidic and helping to correct acidosis. 4. Neutralizes gastric acid. When taken orally, sodium bicarbonate neutralizes excess stomach acid, providing relief from heartburn and indigestion. 5. Shifts electrolytes, especially K. Sodium bicarbonate can influence the movement of electrolytes, particularly potassium ions K, by encouraging them to shift into cells, which can help manage conditions like hyperkalemia. Storage and disposal of sodium bicarbonate. 1. Store in tightly closed container at room temperature. Sodium bicarbonate should be kept in a sealed container to prevent moisture and air from affecting its quality, and stored at room temperature to maintain its stability. 2. Protect from moisture and heat. Moisture can cause sodium bicarbonate to clump or degrade, while heat can lead to decomposition, so it's essential to keep it away from both. 3. Discard if clumped or discolored. If sodium bicarbonate becomes clumped or discolored, it may be a sign of degradation or contamination, and it's best to discard it to ensure safety and effectiveness. Drug interactions with sodium bicarbonate. 1. Calcium salts (CaCl), Ca-gluconate leading to precipitation. When sodium bicarbonate is mixed with calcium salts, it can form a precipitate, which may affect the efficacy or stability of the solution. 2. Tetracyclines, quinolones leading to reduced absorption. Sodium bicarbonate can decrease the absorption of certain antibiotics, such as tetracyclines and quinolones, potentially reducing their effectiveness. 3. Aspirin, salicylates leading to urinary alkalinization in clearance. Sodium bicarbonate can increase the pH of urine, enhancing the elimination of aspirin and other salicylates from the body, which may affect their therapeutic levels. 4. Potassium supplements leading to reduced effect of hyperkalemia therapy. When sodium bicarbonate is used to treat hyperkalemia, concurrent use of potassium supplements may counteract the therapeutic effect, potentially reducing the efficacy of the treatment. Clinical uses of sodium bicarbonate. 1. Metabolic acidosis (DKA), renal failure, shock. Sodium bicarbonate is used to treat metabolic acidosis, a condition where the blood becomes too acidic, often due to diabetic ketoacidosis (DKA), kidney failure or shock. 2. Cardiac arrest, not routine, but used in prolonged resuscitation with severe acidosis. In cases of cardiac arrest with severe acidosis, sodium bicarbonate may be used during prolonged resuscitation efforts to help restore a stable heart rhythm. 3. Drug overdose, tricyclic antidepressants, barbiturates, salicylates, cocaine, diphenhydramine. Sodium bicarbonate can help manage certain drug overdoses by correcting acidosis or reducing the toxicity of specific drugs. 4. Hyperkalemia, temporary shift into cells. Sodium bicarbonate can temporarily shift potassium ions into cells, helping to manage high potassium levels in the blood. 5. Rhabdomyolysis, alkalinizes urine to prevent myoglobin nephropathy. By alkalinizing the urine, sodium bicarbonate may help prevent kidney damage in patients with rhabdomyolysis, a condition where muscle tissue breaks down. 6. Crush injuries, to reduce acidosis and renal damage. Sodium bicarbonate may be used to help reduce acidosis and prevent kidney damage in patients with crush injuries. 7. Acid, oral, for dyspepsia, peptic ulcer, rarely used now, although less common today. sodium bicarbonate can be used orally as an antacid to relieve symptoms of heartburn, indigestion, and peptic ulcers. Use of sodium bicarbonate in ICU. 1. Sodium bicarbonate is used in the intensive care unit (ICU) for the treatment of severe metabolic acidosis, particularly when the pH level falls below 7.1. In such cases, the body's buffering system is overwhelmed, and the acidosis can lead to serious complications, including organ dysfunction and impaired cardiac function. 2. Management of drug overdoses (TCA). Salicylates in the ICU. Sodium bicarbonate can be used to manage overdoses of certain medications, such as tricyclic antidepressants (TCA) and salicylates, by helping to correct acidosis and reduce toxicity. 3. Hyperkalemia emergency measure. Sodium bicarbonate may be used as an emergency measure to temporarily shift potassium ions into cells, helping to manage life-threatening hyperkalemia. 4. Alkalinization in tumor lysis syndrome. In the ICU, sodium bicarbonate can be used to alkalinize the urine in patients with tumor lysis syndrome, helping to prevent kidney damage by reducing the precipitation of uric acid and other metabolites. Use of sodium bicarbonate in anesthesia. 1. Corrects intraoperative metabolic acidosis. Sodium bicarbonate is used during surgery to correct metabolic acidosis that may develop due to various factors, such as prolonged anesthesia or tissue hypoperfusion. 2. Used during CPR when prolonged acidosis present. In cases of prolonged cardiac arrest with significant acidosis, sodium bicarbonate may be administered during CPR to help restore a more normal acid-base balance. 3. May be given in massive transfusion to buffer toxicity and acidosis during massive blood transfusions. Sodium bicarbonate can be used to buffer the citrate preservative in blood products, which can cause metabolic acidosis and hypocalcemia. Use of sodium bicarbonate in emergencies. 1. Cardiac arrest. After prolonged resuscitation, sodium bicarbonate may be used in cardiac arrest situations where prolonged resuscitation efforts have led to significant acidosis, helping to restore a more normal acid-base balance. 2. Poisoning, overdose, e.g., tricyclic antidepressants, salicylates. Sodium bicarbonate can help manage specific types of poisoning or overdose by correcting acidosis, enhancing elimination of the toxin, or reducing its toxic effects. 3. Severe hyperkalemia. In emergency situations, sodium bicarbonate can help temporarily shift potassium ions into cells, rapidly lowering serum potassium levels and reducing the risk of cardiac arrhythmias. Dosage of sodium bicarbonate. 1. IV, emergency metabolic acidosis, 1 MEq per kilogram bolus, then guided by ABG. In emergency situations, a bolus dose of 1 MEq per kilogram is given intravenously, followed by further dosing guided by arterial blood gas, ABG, results to ensure proper correction of acidosis. 2. Hyperkalemia. 50 MEq IV over 5 minutes. For severe hyperkalemia, 50 MEq of sodium bicarbonate is administered intravenously over 5 minutes to help rapidly shift potassium ions into cells. 3. Overdose, alkalinization. 1 to 2 MEq per kilogram IV, repeated as needed. In cases of overdose or for urinary alkalinization, a dose of 1 to 2 MEq per kilogram is given intravenously, with repeat doses administered as necessary based on clinical response. 4. Oral, Antacid, 325 2000 mg every 4 to 6 hours, rarely used now, although less common today. Sodium bicarbonate can be used orally as an antacid, with doses ranging from 325 to 2000 mg every 4 to 6 hours as needed for relief of heartburn and indigestion. Side effects of sodium bicarbonate. 1. Metabolic alkalosis. Overcorrection with sodium bicarbonate can lead to metabolic alkalosis, a condition where the blood becomes too alkaline. 2. Hypernatremia. Fluid overload. Sodium bicarbonate contains sodium, which can contribute to high sodium levels in the blood, hypernatremia, and fluid overload, particularly in patients with heart or kidney issues. 3. Hypokalemia. As sodium bicarbonate shifts potassium ions into cells, it can lead to low potassium levels in the blood, hypokalemia. 4. Hypocalcemia. Tetany. Sodium bicarbonate can bind to calcium ions, potentially leading to low calcium levels, hypocalcemia, and muscle cramps or spasms, tetany. 5. Gastric distension. Belching. Oral use. When taken orally, sodium bicarbonate can release carbon dioxide in the stomach, leading to bloating, discomfort, and belching. 6. Tissue necrosis if extravasated. If sodium bicarbonate leaks out of the vein during IV administration, it can cause tissue damage and necrosis due to its high pH. Contraindications of sodium bicarbonate. 1. Metabolic or respiratory alkalosis. Sodium bicarbonate is contraindicated in conditions where the blood is already too alkaline, as it can worsen the imbalance. 2. Hypocalcemia worsens symptoms. Administering sodium bicarbonate in patients with low calcium levels can further decrease calcium levels, exacerbating symptoms. 3. Hypernatremia. Sodium bicarbonate contains sodium, and its use in patients with high sodium levels can worsen hypernatremia. 4. Overload, CHF. Renal failure. Patients with congestive heart failure, CHF, or renal failure may not be able to handle the sodium and fluid load from sodium bicarbonate, leading to volume overload and potential complications. Toxicity of sodium bicarbonate. 1. Excess bicarbonate. Right-pointing arrow. Metabolic alkalosis. Too much sodium bicarbonate can lead to an overcorrection, causing metabolic alkalosis, a condition where the blood becomes too alkaline. 2. Symptoms. Confusion, muscle twitching, arrhythmias, hypoventilation, seizures. Metabolic alkalosis can cause a range of symptoms, including neurological effects like confusion and seizures, as well as respiratory and cardiac issues. 3. Severe cases. Hypokalemia, hypocalcemia, tetany. In severe cases of metabolic alkalosis, sodium bicarbonate toxicity can lead to low potassium levels, hypokalemia, low calcium levels, hypocalcemia, and muscle cramps or spasms, tetany. Management of sodium bicarbonate toxicity. 1. Stop infusion. The first step in managing toxicity is to immediately stop the sodium bicarbonate infusion to prevent further overdose. 2. Correct electrolytes, Ca². Administering potassium-calcium supplements can help correct the electrolyte imbalances, hypokalemia and hypocalcemia, that may have resulted from sodium bicarbonate toxicity. 3. IV fluids and supportive care. Providing intravenous fluids and supportive care can help manage symptoms and stabilize the patient. 4. In severe cases leading to dialysis. In severe cases of sodium bicarbonate toxicity, dialysis may be necessary to rapidly correct the acid-base imbalance and remove excess bicarbonate from the body. ECG changes with sodium bicarbonate overdose, alkalosis. 1. Prolonged QT. Sodium bicarbonate overdose or alkalosis can lead to prolonged QT intervals on the ECG, which can increase the risk of arrhythmias. 2. U waves. The ECG may also show U waves, which are often associated with hypokalemia, a potential consequence of sodium bicarbonate use. 3. Arrhythmias secondary to hypokalemia, hypocalcemia. The electrolyte imbalances caused by sodium bicarbonate overdose, particularly hypokalemia and hypocalcemia, can lead to various arrhythmias, which can be seen on the ECG. Special precautions with sodium bicarbonate. 1. Give only when ABG confirms acidosis. Unless emergency, sodium bicarbonate should ideally be administered only when arterial blood gas, ABG, results confirm acidosis, except in emergency situations where immediate action is necessary. 2. Avoid mixing with calcium solutions. Precipitate risk. Sodium bicarbonate should not be mixed with calcium-containing solutions, as this can lead to the formation of a precipitate, potentially affecting the efficacy or stability of the solution. 3. Monitor pH, Na-K, Ca² during infusion. Close monitoring of pH, sodium, potassium, and calcium levels is essential during sodium bicarbonate infusion to prevent overcorrection and ensure safe treatment. Clinical pearls for sodium bicarbonate use. 1. Not a first-line drug in cardiac arrest anymore, leading to only if severe acidosis or hyperkalemia. Sodium bicarbonate is no longer a primary treatment in cardiac arrest unless there is evidence of severe acidosis or hyperkalemia, where it can provide specific benefits. 2. In diabetic ketoacidosis (DKA), the primary treatment approach involves administering fluids and insulin to rehydrate the patient and restore fluid balance, lower blood glucose levels and reduce ketone production. Sodium bicarbonate is generally not recommended as a first-line treatment in DKA, except in severe cases where the pH level falls below 6.9. This is because fluids and insulin typically help correct acidosis by improving tissue perfusion and reducing ketone production. Overuse of bicarbonate can lead to potential complications, such as worsening intracellular acidosis or electrolyte imbalances. 3. Always administer via large vein or central line to prevent extravasation injury. Sodium bicarbonate should be administered through a large vein or central line to minimize the risk of extravasation, which can cause tissue damage. 4. Check ABG before and after use to avoid iatrogenic alkalosis. Arterial blood gas (ABG) analysis should be performed before and after sodium bicarbonate administration to ensure proper dose and prevent overcorrection, which can lead to iatrogenic alkalosis. Sodium bicarbonate. Summary table. Quick revision. 1. Drug. Sodium bicarbonate, NaHCO. A medication used to neutralize excess acid in various medical conditions. 2. Class. Antacid alkalinizer electrolyte. It belongs to a class of drugs that help neutralize stomach acid and restore the body's acid-base balance. 3. Mechanism. Buffers H leading to raises pH. Sodium bicarbonate works by buffering hydrogen ions, which increases the pH level in the blood and correct acidosis. 4. Absorption. Rapid oral, immediate IV. When taken orally, sodium bicarbonate is absorbed quickly, while intravenous administration provides an immediate effect. 5. Excretion. Renal. Sodium bicarbonate is primarily excreted through the kidneys. Uses. 1. Metabolic acidosis. Treats conditions where the blood becomes too acidic. 2. Hyperkalemia. Helps manage high potassium levels in the blood. 3. Drug overdose. Used in specific cases of poisoning or overdose. 4. Cardiac arrest. May be used in certain situations during cardiac arrest. 5. Urine alkalinization. Helps increase the pH of urine, which can aid in the elimination of certain toxins. Dosage. IV. 1 mEq per kilogram bolus, guided by arterial blood gas (ABG) results to ensure proper correction. Side effects. 1. Alkalosis. Overcorrection can lead to alkalosis, a condition where the blood becomes too alkaline. 2. Hypokalemia. Low potassium levels can occur as potassium shifts into cells. 3. Hypernatremia. High sodium levels can result from excessive administration. 4. Hypocalcemia. Low calcium levels can occur due to binding with bicarbonate. 5. Fluid overload. Excessive fluid retention can lead to complications. Contraindications. 1. Alkalosis. Sodium bicarbonate is contraindicated in conditions where the blood is already too alkaline. 2. Hypernatremia. Patients with high sodium level should avoid sodium bicarbonate. 3. Hypocalcemia. Low calcium levels can be worsened by sodium bicarbonate administration. Toxicity signs. 1. Tetany. Muscle cramps or spasms can occur due to electrolyte imbalances. 2. Seizures. Severe cases of toxicity can lead to seizures. 3. Arrhythmias. Abnormal heart rhythms can result from electrolyte disturbances. Special uses. 1. Anesthesia. Used to correct intraoperative acidosis or during prolonged resuscitation. 2. ICU. Treats severe metabolic acidosis, overdose, and hyperkalemia in critically ill patients. 3. Emergency. Used in cardiac arrest, poisoning, and crush injuries where rapid correction is necessary. OSCE exam tips for sodium bicarbonate. 1. Why is sodium bicarbonate not given routinely in cardiac arrest? Sodium bicarbonate is not routinely given in cardiac arrest because it can worsen intracellular acidosis and cause electrolyte shifts. It is only indicated in prolonged arrest with severe acidosis or hyperkalemia. 2. When do you give sodium bicarbonate in DKA? Sodium bicarbonate is considered in diabetic ketoacidosis (DKA) only if the pH is less than 6.9, as the primary treatment involves fluid insulin. 3. What happens if you mix sodium bicarbonate with calcium solutions? Mixing sodium bicarbonate with calcium solutions can lead to a precipitation reaction, where calcium carbonate forms, potentially affecting the efficacy or stability of the solution. 4. How does sodium bicarbonate help in hyperkalemia? Sodium bicarbonate helps in hyperkalemia by inducing alkalosis, which shifts potassium ions K into cells, temporarily lowering serum potassium levels. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.